Hi, I'm Robert F. Kennedy Jr., your HHS Secretary. I'm joined today by CMS Administrator Dr. Mehmet Oz. For years, Americans have walked into hospitals with no idea what their care would cost and walked out with medical bills that wiped out their savings. That ends now. Under President Trump's leadership, HHS is finally getting serious about hospital price transparency. The goal is simple: make health care more affordable by giving every American the ability to shop for care, compare prices, and make informed decisions before they set foot in a hospital. Price should never be a surprise. Cost should never be a barrier.
Since President Trump's first term, every hospital in America has been required to post their prices online publicly in a format anyone can access, showing what the hospital actually charges for every service it provides. Unfortunately, the Biden administration did not enforce these rules. It even told hospitals they could get away with ballpark estimates, not real prices. Immediately after returning, President Trump told us to fix that. So last year, Secretary Kennedy and I worked on regulations to get the real prices to you, the American people. We want to make it easy for you to compare hospital prices against other hospitals nearby so that you can get the best care for you and your family. But you can't do that if hospitals aren't complying with our new requirements. Now, we told hospitals we would begin enforcing these rules on April 1st. Since then, our teams have been actively looking at thousands of hospitals to see if they are following the rules.
Consider this a formal notice to every hospital in America still hiding prices from patients. We know who you are. Significant enforcement began 2 months ago. The grace period has ended. There are no further extensions. If your hospital is not yet in compliance, you are in violation of federal law.
To date, CMS has identified and sent letters to more than 500 hospital facilities who are not yet following the rules. Many of the hospitals are owned by large, well-resourced health systems, billion-dollar networks with armies of lawyers and compliance teams and lobbyists, and are still hiding their prices from the patients that they serve. That is unacceptable. If those hospitals do not come into compliance and transparently display their prices to patients, they will be fined to the fullest extent that the law allows. Federal fines accumulate every single day. Larger facilities can face penalties reaching $2 million for a single year of noncompliance.
Pharmaceutical companies, insurance companies, hospitals, no administration in history has done more to hold healthcare conglomerates accountable than the Trump administration. We will use every tool at our disposal to drive down costs for the American people.
Price transparency is central to President Trump's great healthcare plan to lower costs, reduce premiums, and put patients back in control.
Our message to hospitals is simple: post your real prices, come into compliance immediately, or prepare for serious consequences. Don't wait for a penalty notice. By then, it may be too late.
Produced by the U.S. Department of Health and Human Services.